Felicia Hill-Briggs is here now, the President of Healthcare and Education for the American Diabetes Association. Thank you for joining me.
My pleasure.
Talk to me about your role in educating people and in the healthcare system.
Well, I'm very honored to be the 2018 President of Healthcare and Education for the American Diabetes Association. So in my role, I get to represent the thousands of professionals who spend their lives doing research and doing practice in health education. The certified diabetes educators and other diabetes education support personnel, people who do nutrition, people who work with people with diabetes distress, psychological needs and issues. And so we work to ensure that people living with diabetes are able to integrate diabetes into their lives and still live lives that are high quality of life with their diabetes. And so we have many, many educational programs and resources. The American Diabetes Association Standards of Care provides guidance in diabetes self-management, education, and support programming and tools. And so here at Scientific Sessions, all of those areas are well represented.
When you talk about that education, how critical is it to educate the healthcare providers, and how does it trickle down to the people who are living with diabetes every day?
So it's critical, of course, that all providers working with people with diabetes understand their behavioral and their social needs. We know that medical care accounts for only about 5 to 10% of the outcomes that we see in diabetes. And people are much more greatly affected by their behavioral and lifestyle choices, by their social circumstances and what we now refer to as social determinants of health. And so it's critical that all providers be able to recognize these particular needs that their patients have, and for them to either be able to address those needs directly in the primary care setting, in the endocrine setting, or to make the appropriate referrals to specialists such as diabetes educators and nutritionists, psychologists, other mental health practitioners, social workers, all of those members of our healthcare teams who are really essential for people being able to live their best lives.
Yes, I mean, those teams can certainly enhance people's health. You have a wide audience here at the meeting.
Yes.
If you could give a message to them, what would it be?
I think it would be that ultimately our goals, the goals of the American Diabetes Association and the goals of our scientific community and our practice communities are to improve the lives of all people with diabetes. And it's a challenge to do the life improvement, and it's a challenge to hit all people. And so we have a great deal of focus now more on population health, and that is ensuring that we're not only showing these types of improved diabetes outcomes and quality of life at the individual level, where we can say this one person is better, but being able to see improvements that are measurable across our entire population. And so that includes things such as making sure our underserved communities are touched with education and support. It's making sure that people in our rural areas, it's making sure that both young people with diabetes as well as older adults with diabetes are all able to access the care and educational needs that they have and receive those appropriate services.
It's such important work. Thank you so much, Felicia Hill-Briggs.
Thank you.